This video is on the neurological physical examination. We will overview the main steps to the exam and focus on the interpretation of possible signs. We will also provide hints as to exam technique, but we will not focus on how to perform each step. As with all exams, the first step is general observation, so looking around the room as well as looking at the patient. You may look around the room to see if there's any walking age, which would be suggestive of gait disturbances such as from a stroke or a cerebellar lesion. You can also observe the patient for their posture. Are they leaning more to one side? Could they then have hemiplegia on that side or weakness from a stroke? Look broadly for muscle wasting, any obvious cachexia or malnutrition, as well as more subtle muscle wasting in the quadriceps if there's been prolonged weakness, as well as the thenar and hypothenar muscles in motor neuron disease. Observe for any tremor. At this stage, it would be a resting tremor, suggestive of Parkinson's disease. You notice any fasciculations, which would be suggestive of a lower motor neuron disease. The first unique part of the neurological exam is assessing for tone. So test all major joints and vary the speed. Varying the speed is so important because that is what shows you cogwheel rigidity in Parkinson's disease. Assess for hypertonia in an upper motor neuron disease or hypotonia in a lower motor neuron disease. And it's important you can vibe this with experience whether it's hyper or hypotonia, but a nice trick if you're testing the legs is to you kind of just lift the leg, and drop it at the level of thigh. Normally the ankle should stay on the bed, but if the ankle lifts off the bed, this is suggestive of hypertonia. The next point is power, and you want to test across all myotomes, and I outlined them in that picture. You want to test one joint at a time and map the pattern of any weakness, because this will help you for your pattern recognition in determining the location of the lesion. Grading power is also important. So 0 is the muscles can't move at all. 1 is that it kind of moves, a bit of a flicker. 2 is that it can move side to side, or technically when gravity is removed. 3 is that you can lift it, so move against gravity. 4, you can move against gravity, move against some resistance, but not quite normal. And 5 is normal, they can oppose your strength. Reflexes is also important, maybe the most important thing in determining whether it's hyper or hyporeflexic, because hyporeflexic is upper motor neuron, hyporeflexic is lower motor neuron. And unlike tone, which can be quite difficult to make that judgment call based on your experience, reflexes are often easier to listen. The main reflexes you want to test are the biceps reflex, the triceps reflex, the supinator reflex in the upper limb, and in the lower limb, assess the knee, the ankle, and the plantar reflex. The plantar reflex is also known as the Babinski reflex. Then you want to test sensation, so this is testing fine touch. You can do this with the cotton or tissue. Ask them to close their eyes and tell you when they detect the cotton on their skin. And you want to see if it's a dermatomal distribution as shown in that diagram. Temperature and pinprick, you can do this with something cold, or if you have it, a fancy pinprick. And this is assessing the spinothalamic tract because pain and temperature are carried in the spinothalamic tract. Then assess for proprioception, as shown in that diagram. You're moving the thumb, and it's important to be on the sides of the thumb, not on the knuckle, as this is picked up by a different sensation. And you want to ask them if they can feel the thumb moving up or down, and this tests proprioception, which is mediated by the dorsal column medial lemniscus. There come some other specific tests you can also do for neurology. The finger to nose test, testing for cerebellar lesions, and for the finger to nose test specifically, you're looking for any tremor, any intention tremor, so they won't have the tremor to rest, but when they're extending out to your finger at full length, then they'll have the tremor. And looking for any past pointing, so they don't touch your finger, they go past it. You can assess for pronated drift, so you ask your patient to extend both their arms palms up, and then if it drifts, if they have moved their palms to be down, then that's abnormal and is reflective of a cortical spinal lesion. And that's, pronated drift, so they're pronating, the palms are going down. Finally is gait assessments, to ask them to walk heel to toe, ask them to walk on the tips of the toes and on their heels, and this can assess for any balance issues as well as any myotomal issues. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.